I'm Erin Fosdick, Senior Planner with the Economic Development Department. During this pre-recorded presentation, I'd like to provide you some information on a Longmont Area Comprehensive Plan update to include concepts of community health and wellness. As you know, the Longmont Area Comprehensive Plan is the city's vision document. It's important to note that this document is not a regulatory document, rather it's a big picture policy document. Earlier this year, the Planning and Zoning Commission recommended approval of amendments to the Longmont Area Comprehensive Plan to include a new community health and wellness chapter and updates to the transportation chapter. The new community health and wellness chapter is organized around 4 key goals. These goals are helping Longmont be a healthier community, integrating land use and transportation so that activity can be incorporated into people's daily lives, promoting access to healthy food, and supporting the local food system. The overarching theme of this chapter is choice. The intent is not to mandate health or restrict options, but rather to identify ways and create opportunities to support community choice. There's a number of attachments included in your packet for our meeting on December 11th, and I wanted to take just a minute to go through these with you. In addition to the Planning and Zoning Commission resolution and minutes from their meeting in May, we've included the May 16th packet for your reference. I'd specifically like to point out that the draft Community Health and Wellness chapter, as approved by the Planning and Zoning Commission, is in that packet, as well as a redline version of the Transportation chapter with changes to support active transportation. The Parks and Recreation Advisory Board and the Transportation Advisory Board have also made a recommendation on this material. Minutes, as well as additional changes suggested by both of those boards, are included in your packet as well. Finally, as council members will recall, City Manager Harold Dominguez and I have met with council members individually to talk a little bit more about this update and provide some background and context. During the course of those discussions, several council members expressed an interest in seeing this material integrated throughout the existing Longmont Area Comprehensive Plan chapters, rather than the standalone chapter that the Planning and Zoning Commission approved. So in response, staff has drafted an alternate version that has this information integrated in the existing chapters. I want to note that the material in this integrated alternative version is virtually the same as what's in the standalone chapter. It's just been interspersed throughout the existing LACP chapters. And where we have suggested points of integration, those chapters have been included in the council packet for discussion. Over the course of the past year or so, staff has met with the Planning and Zoning Commission in a number of work sessions on this topic. In an effort to make sure that this chapter didn't go too far and seem overreaching, there was really a lot of interest and work on the part of the Commission to make sure that this ended up being about choice and opportunity, and I think that you'll see that throughout. During these work sessions, several other community partners and individuals participated with us, and I think the Commission found it really helpful to hear these additional perspectives and get the input from a variety of sources. So in an effort to provide council some of that same benefit, I've asked 3 additional presenters to join me today. Today I'm joined by Jeff Zayak, who's the Public Health Director for Boulder County Public Health, Eric Bergeson, who's the Steering Committee Chair for Live Well Longmont, and Neil Bertrand, who's the Chief Financial Officer at Longmont United Hospital. I've asked each of these presenters to answer a question for us to kind of put things in context and provide a little bit of information. Each presenter will introduce the subsequent presenter, and I will close up the presentation. With that, I would like to turn it over to Jeff. And the question that I've asked Jeff to answer is, we always hear that Colorado is the leanest state in the nation. Is that really true?
My name is Jeff Zayak, and I'm the Public Health Director with Boulder County Public Health. And that is true, Erin, but it comes with some significant qualifiers that I'd like to highlight for you. This first slide shows our significant and concerning trend toward an obese nation. This data is between the years of 1990 and 2010, and basically what you're seeing here, if you look at the map with 1990 in the light blue colors, and then down to the map of 2010 with dark red colors. Dark red is bad and light blue is good. So we've seen a significant negative trend in obesity increases across our nation. Rates of obesity have increased for all adult age groups and across all regions of the United States. More than 72 million adults, that's more than 1 in 3, and 17% of all children are obese. A little more data on Colorado itself as our leanest nation, or our leanest state. Despite this ranking, more than half of Colorado adults are overweight or obese. Obesity rates have nearly tripled since 1990 in Colorado alone. From 1995 through 2008, Colorado obesity rates rose 89%. And even in Boulder County, which is touted as one of the leanest counties in the state, we have our own challenges. In Boulder County, our obesity rates have increased 20% since 2004, with over 31% of our adults being overweight and 15% obese in 2010. When we look at these same trends in our Hispanic population, they are worse, indicating that we have clear disparities that we need to address. What you see in this slide here is an actual positive trend overall. This is St. Vrain Valley School District data from our Youth Risk Behavior Survey, and it indicates that St. Vrain Valley School District high school kids have a downward trend in obesity. We'll be working more with the school district to better understand this trend, but we believe it's associated with some of the great partnerships and some of the great work that St. Vrain Valley School District is doing. And even with this data and this positive trend, you see the significant Latino disparity that's of concern in that purple line on that graph. We still have some work to do. In this last slide, this is a significantly concerning trend for us. Although we saw that promising trend in St. Vrain Valley School District high school kids, we are seeing this alarming trend in our youngest children. Data from our Longmont Women, Infant, and Children's Program demonstrates a negative increasing trend of overweight and obesity in our 2 to 5-year-olds between 2002 and 2010. And some of the costs of chronic disease if we don't deal with these issues: unhealthy weight's been associated with type 2 diabetes, cardiovascular disease, hypertension, among many other negative health outcomes. Total cost for treating obesity in the United States is estimated to be as high as $300 billion a year. Direct medical costs of treating obesity is estimated at $147 billion a year. And cost to U.S. employers and lost productivity is estimated at $73 billion a year. One California study of all adult workers found that a 5% improvement in physical activity and healthy weight would have brought an estimated savings of at least $6 billion over a 5-year period. So how does this relate to what's happening in Longmont and what's happening in our county? Over the past 2 years, Boulder County Public Health has involved hundreds of stakeholders in conducting community needs and capacity assessment. 3 priorities emerged as major community needs, one of those 3 being addressing overweight and obesity through a focus on healthy eating and active living in our community. The focuses on evidence-based prevention through healthy eating and active living in this county plan directly complements strategies that are being considered in the proposed health and wellness chapter of Longmont. The city of Longmont should be commended for taking an active role in addressing a significant community need that has an economic and quality of life impact for all that live within its city boundaries. At this point, I'd like to introduce Eric Bergeson, who's the steering committee chair for Live Well Longmont. Thanks.
Thanks, Jeff. The question I've been asked is, in the role I played in site selection process to bring a major operation for a large corporation here to Longmont, whether health played or was a factor in that decision. Back in the mid-90s, I was fortunate enough to be on a site selection team for Amgen to try to identify a location for us to transfer a pretty significant manufacturing operation in order to replace an aging and undersized facility. So as part of that process, you can imagine, pretty important decision for the company. We went through a pretty major exercise in doing that, developing a variety of matrices, looking at a lot of geographical regions throughout the U.S. And outside the U.S. to determine where we ought to put this manufacturing facility. It all really boiled down to 3 major categories, and that are cost, infrastructure, and the company's ability to attract talent to that new operation. And so it ended up being a handful of companies, a handful of locations that we were looking at in the U.S. and outside the U.S. in terms of making this decision. But at the end of the day, it really boiled down to 2 locations that we were looking at. One was Puerto Rico, and the other was Longmont. And the reason that it really boiled down to those 2, all else sort of being equal, was the fact that Amgen already had some operations in those locations. The factors that really came to bear in making that decision ultimately came down to 2 things. Puerto Rico had a fairly significant advantage in the fact that they had a much better tax treatment for the company because of some federal rules related to Puerto Rico as a territory for pharmaceutical companies. But the other factor that was significant that Longmont had a major advantage in, at least we felt, was the ability to attract talent to this company, to the company and to this operation. And at the end of the day, that's what tipped the scales in our decision to bring the manufacturing operation here to Longmont. I can't tell you just how fierce the competition is for a lot of these high-tech companies like Amgen in terms of trying to bring in talent to the companies, so it becomes a major factor in a lot of these decisions. And so when we talk about the ability to attract talent, at least in the context of a site selection like this, we're really talking about quality of life. Do people really want to live where we're setting up this operation? And that becomes a major factor. We're seeing more and more that the professionals that companies like Amgen would like to bring into the company are concerned about health and the ability for themselves and their families to lead healthy lifestyles. Colorado, as we know, and Jeff mentioned already, has a reputation of being one of the healthiest, if not the healthiest, on one dimension at least, state in the country. And frankly, I think it's something that Colorado needs to do more in terms of promoting itself for bringing large employers into the state. Likewise, I think Longmont is uniquely positioned to use that as a competitive advantage moving forward, given where we're located in the state and everything that we have to offer around here in Longmont. Health costs are just going to continue to decrease throughout the country, and I think this is just going to continue to be a major factor in where companies want to locate. And I really think as Longmont looks forward in its vision, this is why I think that a health chapter in the comprehensive plan would be a brilliant strategic move for Longmont in terms of investing in the future for the company. When I think about the marketing that Longmont is walking into, I think if we could say that you belong in Longmont because we're making it easier for you and your family to lead a healthy lifestyle, I think that would be a powerful statement for the community. And now I'll turn it over to Neil Bertrand, CFO of Longmont United Hospital.
We often hear that healthy choice is going to cost more. I disagree. I'm Neil Bertrand, Chief Financial Officer of Longmont United Hospital for the last 11 years. I'm also currently Board Treasurer of LiveWell Colorado since 2010. First, a little bit of history. When I was Board Chair of the Longmont YMCA, we participated in a national Y program, Activate America. The Y received a $40,000 grant to send 10 community members to Washington, D.C. to focus on getting people physically active. The committee was a broad coalition of the community with the mayor, the president of the school board, the CEO of the Y, some Y board members, the CFO of Longmont United, a representative from Boulder County government, and others. This committee became the founding steering committee for creating LiveWell Longmont, which has received over $1.7 million in grant money to establish community vegetable gardens, engage the St. Vrain Valley School District in various wellness and healthy eating activities, and to create a coalition of worksite wellness programs with the City of Longmont, the school district, and the hospital that jointly fund and share a worksite wellness coordinator position. The purpose is to share best practices to further develop and enhance our programs. We also have competitive activities with rewards for successful teams that earn most steps, maintain or lose weight during the holidays, and organizations whose employees complete the most health risk assessments and biometric screenings. Since 2010, Longmont United has established a web-based employee wellness program called Healthy Roads. It synchronizes with our self-funded health plan's benefit design. It creates an opportunity for completers to annually earn $1,080 as a reduction of the employee's cost of health care coverage. For 2013, that amount is $1,120 that each employee will receive. Almost 700 of our employees, or 75%, are completers. Completers earn 300 points annually on health awareness, healthy eating, and having active lifestyles. Since we implemented the employee wellness program with a consumer-driven self-funded health plan, LUH has reduced our claims paid by over $1 million a year annually for a total savings of $3.2 million. LUH has more than covered the cost of our wellness programs and wellness incentive payments to our employees with these substantial savings. I know from my own personal experience that when I'm physically active, eat right, and I have more energy, rarely have sick days, can handle stress better, and just get more done. This is true for the LUH workforce. Healthy eating and active living saves real dollars that can be reinvested and shared with the employees. Healthy eating and active living initiatives brought almost $2 million in new grant money to Longmont. I truly believe that individual responsibility for healthy eating and active living is key for our community, and that the city needs to support personal health initiatives any way it can. We all individually need to take responsibility for our own health, and Longmont needs to be the leader in Colorado and the nation to create an environment for healthy eating and active living so we can accomplish that goal. Healthy choices save money more than they cost. Thank you. Now to Erin.
Thank you, Jeff, Eric, and Neil. So I plan to ask you to join us again on the 11th to continue this discussion and answer any questions that your presentation might have brought up for council. And in closing, we'll be asking you, council, for some direction on what you'd like to see us bring forward when we do bring this information to you on first and second reading and public hearing. We'll be bringing back the Planning and Zoning Commission version, but we'd like to have a discussion with you on what else you'd like to see brought forward. With that, I'll conclude our presentation. I look forward to talking with you on the 11th. Thank you.